I
Hello,
love it.
Tamsen. Thank you so much for that generous introduction.
Well, I'll tell you what, you have learned so much over the years about helping women feel and look younger. We've had a lot of conversations about it, a lot of conversations. And I'm just wondering, like in this time of, and I turned 50 this year. That was my big, like transformative, oh my gosh, what happens now? In this time, are you seeing a lot more women embracing how they look or coming and getting some kind of, things done or not worrying about it at all because we're in a pandemic?
Well, happy birthday. This should be a
I'm
fabulous
milking it
year.
for a year, by the way. The birthday was in, December. I'm just milking it for the year.
Of course, you celebrate in perpetuity, right?
Yes, yes.
Well, thank you very much for having me on your show. I think it's fantastic. And in answer to your question, yes and no. Perhaps because of the pandemic, I have been seeing women and men, but mostly women in my practice, who have embraced how they look, who have taken on a philosophy of aging gracefully, and that meaning naturally and not doing anything. And I also have women in my practice who have reconsidered aging gracefully, or at least redefined it and thought, okay, yes, I am healthy, I'm feeling well. However, there's always a little bit of improvement that I may do to help myself feel better and come back looking and feeling stronger and more fabulous than ever.
When you talk about holistic beauty, you're not just talking about the outside. You say it has to come from the inside too. So don't just come to me and want me to fix it all up, because you've still got to do your own thing when you walk out of that office.
That is my philosophy, and it isn't popular with everyone, believe me. I have seen patients who just don't have that same beauty philosophy, and they just want the operation or they just want the procedure, and I respect that, and there's certainly, room for that. But staying true to how I grew up and culturally what I believe about outer beauty, I do believe that there is some inner work that has to be done, right? And that inner work involves pretty much wellness and all the dimensions of wellness, as well as medical health. So for me, beauty as part of a wider definition is manifested from the inside out. And what I do as a plastic surgeon is really enhance that. So I help to enhance, hopefully, what is already there, and certainly what is not there, I can create to a certain extent.
I like when things are created. Let's talk about wellness a little bit, because I never, you knew me for a long, long time. I never went without makeup. I would come to your office with makeup, and I'd be like, "We're taking it off to do something," because that was always just kind of it was what I did with TV, and it's what I do with my job. And now I've realized, maybe in the past 2 years, I'm really more comfortable without my makeup, which I should have been doing it maybe 20 years ago instead of now, but I'm realizing that less is more in so many ways. And the most important part is doing what you're talking about, whether it's sleep, exercise, eating right, hydrating your skin from the inside, not just slapping on a bunch of different products.
Listen, I have to admit, full disclosure, I love products.
Yeah, I know. Well, me too.
And I enjoy wearing makeup. I just don't do it every day. I only wear makeup whenever I have to appear on camera, whether that's television or with you, and even sometimes on my own podcast, because I do think there's something about enhancing your look and the interaction with the lights that really just creates a prettier picture. But I agree with you wholeheartedly that with skin being your most visible accessory and your largest organ on the body, I think it's important to be able to take care of your skin and nurture it and nourish it from the inside. I totally believe in applying products because I do have a little bit of a beauty addiction. So, but I do think that the marriage of inner beauty or inner wellness in combination with nurturing and moisturizing, et cetera, and taking care of your skin and preventing your skin from environmental damage and free radicals and oxidative stress, et cetera. I think it's the marriage of those two that helps one to maintain and create beautiful skin.
Best things people can do to take care of their skin. Like, I know that there's always the magazines are like, in your 30s this, in your 40s this, in your 50s this, in your 60s that. And I was like, oh my gosh. So I didn't do some of those things all those decades, but here's where I am now. But what is the best thing to do for people to say, like, look, I don't wear makeup every day. I don't do that every day. I wash my face. I put on some moisturizer and that's about it. But what do you recommend?
Listen, it's never too late to get on the healthier healthier body, healthier skin bandwagon, right? It's a really important philosophy. And I believe it's a lifestyle. It can't just really be reduced, in my opinion, to doing this at 30 or doing this at 20 or starting to do this at 40, whatever the case may be. And my philosophy is pretty much the same. So I think nutrition, eating well to the best of your ability and to the best of your circumstances, is the first rule of beauty. And I think that has a lot to do with not just hydration and drinking enough water, and not only sleep and getting adequate restful sleep, not sleeping for 7 or 8 or 9 hours in a disturbed manner. But I really do think that's about nourishing the community of microorganisms that are all over our body, all over our skin, and certainly within our gut to help us put our best faces forward.
When we talk about that, going through midlife and menopause and all these things, sleep is hard to come by. There's a book like Why We Can't Sleep, that's out now, and I wholeheartedly understand it. What do you see differently with what hormones and what kind of role sleep and nutrition and diet play with your body as you start to get into this age that we said we were never going to get to?
Well, certainly there is a huge hormonal component to not sleeping well at a certain stage of a woman's life, and also at certain stages of a man's life, right? We, as women, go through menopause, and men go through andropause. So that's just a different definition, but there's definitely a huge hormonal component. Nevertheless, I do believe that some wellness techniques are definitely helpful when it comes to getting more restful, undisturbed sleep. And those include eating well. Now, someone may ask, oh my gosh, eating more vegetables is really going to help me sleep better. No, not necessarily eating more vegetables, but cutting out sugar, reducing sugar, right? Maybe getting your last part of your 1.5 to 2 liters of water a day. Maybe you do that by 8 p.m. instead of by 10 p.m. so you're not getting up in the middle of the night to use the loo. So for sure, I maintain that nutrition, eating well, is the first rule of beauty, and by extension is the first rule of health and wellness.
Yeah, I completely agree. Let's talk about your podcast, because you always have great guests that are really informative, and I love that, because I think that beauty and taking care of yourself is really it's a whole thing. It's not just one area. It doesn't work like that. It can't be just one area. We've learned that there's a balance in all of it. But talk a little bit about the podcast and why you started it, because I remember when you said you were going to, and you kept your promise, and I really like it. You do have some fabulous experts that you know.
Thank you, Tamsen, for asking me about my podcast. You were definitely one of the experts that appeared, and I appreciate your lending me your time. But at the time that we were discussing it, I was looking for a creative outlet, and a creative outlet, but that was also serving my patients and serving people at large, hopefully, if people listen to it.
Right.
So I'm passionate about beauty. I'm passionate about wellness. And, I stick in a little fashion here and there. But I called the podcast Forever Fab. And the FAB is an acronym that stands for fashion, the art of living well, because it is an art. And the last one, all things beauty. So the B is all things beauty. And so I initially started by just dishing what I know. And having listened to myself, I thought, oh my gosh, it's so boring. Oh my God. No one wants to hear me lecture about the microbiome, right? And how the microbiome contributes.
I'll listen to you talk about microbiomes all day, whatever that is.
Right. So basically, I changed up the format because I thought, if I can't listen to this myself and it's me, I don't think anyone else is going to want to listen.
Right.
So I did change the format to interviews with experts in all of those actually fields, in fashion and wellness and beauty and plastic surgery. And every once in a while, I'll dish about plastic surgery, and I'll review a product or review a wellness experience. So that's what it's become. And it's been live, I think, for almost 2 years now. I can't believe
I know. I love it. I love it. All right. So I know you love products. There's all these trends all the time that are going on. And CBD is like the big trend right now. What do you think? What is kind of the tried and true? Like, we've heard olive oil, we heard coconut, we did coconut oil. I've lathered things all over my face. I come home from work and I pull my big eyelashes off, and I'm like, okay, tonight I'm putting coconut oil in my eye. Tonight, olive oil. What are you seeing that is really working right now, or you think is kind of the tried and true?
That's a very good question, and you may get frustrated by my answer, but the tried and true is going to be different for every individual.
Yeah.
There
No,
are
makes sense.
there are so many products coming out all the time, which is very exciting for me.
Yeah.
But it's difficult for anyone, your average person, or maybe you're a super fabulous person, to just walk into a Sephora or an Ulta and be able to pick out what is best for them. I am completely an ingredients person. So you can have the most beautiful packaging. You can donate some of your proceeds to charity and philanthropy. And I think all of that is absolutely gravy and fantastic. But at the end of the day, bottom line is I'm an ingredients girl. So to answer your question a little bit more pointedly, I will tell you, in my opinion, what are some of the most effective scientific literature proven ingredients that you may want to look for, again, at a certain stage in one's life.
Right.
So the first one is going to be hyaluronic acid. And that is a naturally occurring sugar molecule, and it's naturally occurring in our bodies, but manufacturers put it in moisturizers and serums to help our skin to retain that water moisture. So that's really important, because as we grow older, or as we pass through our stages, our skin tends to dry out. So maintaining as much moisture in our skin as possible is quintessential to beautiful, healthy skin. Another all-time favorite of mine is vitamin C. And vitamin C topically, meaning on your skin, is a skin lightener and a skin brightener. And over time, it helps to, reduce fine lines and wrinkles. So those are my top two. I'll add a third one, which is not an ingredient per se, but a type of product, which is a facial oil. And I think they work wonders for my skin, particularly in weather where there's reduced humidity in the air, where it's cold or windy, and skin tends to dry out even more in those types of environments. So the oil, then it has to be a really nice, refined oil applied onto your facial skin. It doesn't moisturize your skin per se, but it will help prevent what I call transepidermal water loss. So it'll help your skin to maintain that moisture.
It's so funny you say that, because for a long time I said like moisturizers don't work, because I would feel like I'm pulling my face all the time to get lotion to stay on, and probably some of the wrong ones. But when I started using facial oil, I fell in love with it. And I have this like little metal thing that you put on your face, and it puts it in there and massages it. And I'm like, this is great. Because I used to run in and run out of the bathroom. I'm like, yeah, I got it all. And I'd stop here, and then they told me you have to do your neck. And then I'm like, oh, so, but I never had the patience to put it on. But I think that if you can simplify your process each night, it feels, or in morning, it doesn't feel so overwhelming to you to have to do.
Well, for some people, simplicity is important. And a woman like you, a woman like myself, and many women don't have the time to spend half an hour to an hour, on a skincare routine. So simplicity for a lot of people is
half a minute.
Half a minute is important, but consistency is also important. Right. Yep. So you don't want to try one product on Monday and then another product on Tuesday, because you're not really giving your skin the opportunity to adapt and necessarily work with the product. And also, I'll say, when you are applying your products, some degree of exfoliation is important, because our skin just keeps, going through its normal process of exfoliation, natural exfoliation, and desquamation is the term. So sometimes you have to be able to help your skin get rid of, the environment on your face, but not overstrip it, of course. And that helps the products to stay on better or be better absorbed, etc.
I love it. All right. There's so much more I could talk to you about. I feel like you're watching me though in my skincare routine, because I have every product in the world. I'm like, I'll try this today. I like this smell today. I like that. And it's about consistency though. It really is. That's a good reminder.
But also not just consistency, if I may add what you mentioned about, doing this facial massage. If you can see your skincare routine, no matter how short it is, as an ode to yourself, right? An act of self-love, an opportunity to just give yourself the time, the compassion, and the love that you need every single day before you give all that stuff away to other people, that might help too.
I love it. Oh, Dr. Shirley, it's so good to see you always.